Automatic tube compensation, also known as ATC in Draeger ventilators, or automatic tube compensation, TC, or tubing compensation on the PB840, or TRC, tube resistance compensation on Hamilton ventilators. Now this is a ventilator screenshot of a Hamilton G5 ventilator, and it shows the automatic tube compensation feature, or as what I stated before, it's called TRC. So automatic tube compensation is a feature, and what it does is allows the operator to select the type of airway, either endotracheal tube or trach tube, and as you notice that the trach tube selected, and it allows you to put the input or the size of the tube. So with these values, and then also there might be a selection of how much you want to compensate for the airway. Automatic tube compensation uses a servo control targeting scheme, so it's very reactive. So what it does is it just generates enough pressure in proportion to the inspiratory and or expiratory flow to compensate for the added resistance of the airway, the artificial airway. Now this is a second screenshot of my G5 ventilator, and it's showing TRC, or automatic tube compensation, in action. And one thing I want to point out is the settings on the right hand portion of the screen. And as you see from the settings, I have a pressure support of 0 and a PEEP of 5, or CPAP of 5. So they're only getting a CPAP of 5. However, if you notice our measured values, we actually have a peak airway pressure of 8. So this shows us currently at this time that the TRC is giving 3 centimeters of water to compensate for the patient's current flow rate. And we kind of look at the screen on how reactive these servo control targeting schemes are. With every breath, there might be a different flow rate, and we might compensate at different pressure levels. If you notice this first one right here, my pressure is approximately 12 centimeters of water. It's a little higher. However, with these breaths, they're smaller and there's less compensation. As previously stated, I mentioned that automatic tubing compensation can compensate both for the inspiratory and expiratory flow, the added resistance during both of these phases. And if we look at the pressure waveform, so here's our pressure waveform now, we'll see that the expiratory component is activated. And one thing we want to notice or point out is that I just have a PEEP of 5, so our baseline PEEP or CPAP should be right here. But what we're noticing is that I have these drops. And I'm just going to highlight these with my laser pointer here. So you have points where it's dropping all the way to 0. So this is my expiratory component of automatic tubing compensation. And during the breath termination, what happens is that the pressure in the exhalation valve is briefly dropped below the set PEEP. So we have a set PEEP of 5, but as you notice, it's dropping all the way to 0 here. But it never goes negative, so it doesn't create a negative pressure. So this decreases expiratory resistance. Now, there's skeptics that are concerned that with these pressure dropping below a PEEP, there's a potential for lung de-recruitment. However, the period is so brief that it's not enough time for de-recruitment. But still, if this is a concern, there's an option to turn off the expiratory portion of automatic tube compensation, which I'll show you on the simulators to follow. This is the Draeger Infinity C500 simulator, and this is just going to show, I'm going to show the automatic tubing compensation feature in this ventilator. And I'm going to go down to my settings here, and it is going to be additional settings. So I have this tab that's additional settings. So it's an augmentation to any of the modes, not just spontaneous modes or modes that allow for spontaneously breathing patient. So even in volume control ventilation or pressure control ventilation, CMV, in Draeger ventilators, I can use automatic tube compensation. And they just labeled ATC. So I'm going to select this tab. And as you notice, my tube compensation is currently off. It allows the operator to turn it on. And then also select the tube type, endotracheotrach, the size of the tube, of course, and how much compensation you want. Another thing you notice with the notes here, that these notes say that expiratory compensation is on, and I set this up actually on the defaults on the machine, and inspiratory compensation is available for both my mandatory breaths and spontaneous breaths. And I set these with the defaults. So I'm just going to turn it on, and you'll just start to see the tracing up here. Now that's just ATC in a Draeger machine. This is my Hamilton C2 ventilator simulator, and I'm going to show automatic tube compensation with this simulator. And also because this ventilator is very responsive, kind of how it works with changes in the patient's effort and the flow rates, inspiratory flow rates. So what we're going to look at first, under my settings, you notice I'm in a spontaneous mode, and I have a pressure support of 10, a PEEP of 5, and if I look under my controls, I can go to TRC. And this is the brand name Hamilton uses for automatic tubing compensation. So TRC is just tube resistance compensation, and it's disabled currently, and we're going to have it currently disabled. And we're going to look at this tidal volume of 482 with this pressure control setting of 10. And I currently have the patient effort at 2 centimeters of water and the patient rate at 10, and my resistance 5, compliance of 50. Now what I'm going to do is I'm just going to, well, before I decrease the pressure support all the way, I just wanted to show that with Hamilton what I can do is I can give pressure support and use the automatic tubing compensation, or TRC, at the same time. So I'm going to select endotracheal tube, and why don't I just start with a tube size of 8, and I'm going to compensate 100% right now, and I'm just going to apply that. And we're going to look at the waveform, and we have two measurements with our pressure. We have the pressure at the trach, or coronal pressure, and then we have the peak airway pressure. And this currently really didn't change my tidal volume delivery at all. Now what I'm going to do is I'm going to take off all my pressure support and basically have it CPAP. And we're going to look at the pressure waveform at this time, and my pressure waveform is pretty much flat. And we'll see my flow waveform down here, and let's see the actual inspiratory flow at this time. So with this patient's flow rate and an 8.0 tube, there's very little resistance in an endotracheal tube of 8.0 for adult patients. And you can see I'm going to go to tab 2, and I have an inspiratory flow rate of only 7 liters per minute right now. So this is creating very little inspiratory resistance. And as you notice, we kind of know that also because with the tubing compensation, that it's not compensating at all now. I have a low flow, low resistance, and my peak airway pressure is unchanged. It's just my CPAP, or PEEP, level of 5. However, let's change the patient effort. I'm going to increase the patient effort to 10. So this should increase my inspiratory flow rate. And let's see how automatic tube compensation compensates. So we just got to give it, as you notice, my flow waveform's changing already. So I have a different inspiratory flow. My drive's higher. I'm getting a little higher tidal volume of 180. If I go to monitoring, you can see my inspiratory flow is now 33 liters per minute. And my pressure is only 6 centimeters of water. So automatic tubing compensation, or TRC, is only given 1 centimeter of water, because with the 802 there's still very little resistance. Let's go ahead and increase the patient's drive again. So with the drive, they're getting a tidal volume around 362, 400. I'm going to change my effort again, make it more vigorous. And let's see how the TRC reacts, or automatic tubing compensation. And as you can see, I'm getting more supporting pressure to overcome the resistance. And my inspiratory flow rate is approximately 66. Now, since this is a servo mode, it's very responsive, and each breath could be different. One breath could be an inspiratory flow of 20, one could be 50. So each pressure waveform is going to be different. However, this is a simulator, and I can't go breath to breath, make it that quick to show the differences. So I'm doing it slowly to show with just different patient efforts, I have different automated responses to correct for that resistance. So my patient has a very high effort now, and you notice my peak pressure is increasing because the automatic tubing compensation is compensated for that added resistance of that higher flow rate. And I have a very high tidal volume. I'm just going to silence the alarm. If you're going to monitor, you see my inspiratory flow rate is 100 liters per minute. So that's creating work for the patient, the endotracheal tube. So it's given some pressure to compensate for that. Approximately 4 centimeters of water. Now, a good example of how endotracheal tubes, the diameter can cause work of breathing. Let's go ahead and just change the size of my endotracheal tube. Let's say instead of an 8.0 tube, the patient had a 6.0 tube, and create the same drive. So first, I'm going to turn this back down to the patient effort of 10 centimeters of water. And kind of let these stabilize again, these measured values. Now it's creating an inspiratory flow of 33 liters per minute. And with the 802, it's doing very little compensation. Now let's turn this down to 6.0. I'm going to apply that. And if the patient had a 6.0 tube, there'd be more resistance of work the patient had to work against. And I'm just going to silence the alarm. Wait. There we go. And as you notice, I do have some compensation of 2 centimeters of water. The patient drive gets higher. Now let's change the patient's drive to 20 centimeters of water. That the TRC, or automatic tubing compensation, is going to compensate quite a bit more. It's actually giving a pressure of value of approximately 8 centimeters of water for this breath phase here. So that's automatic tube compensation. For more information, review the videos on servo targeting schemes.